So measurement, we talked about measurement. So this session is going to be a bit more technical. So be with me. I'll try to be really slow. We'll go through it. And this is very important for you to understand because this is the evidence. This is what it's going to show you the evidence, right? This is what we're going to go back to when we look for evidence. So we talked about measurement in learning sessions 0, 1, 2, right? And we talked about run charts in learning session 2, but I think at that time it was a bit early as well because we didn't have any data to apply those skills, right? Some of these things may not apply, but this is a skill we are all going to gain, and we apply this wherever we see these charts. So the first thing is we need to understand the concept of variation, right? Variation, now there are two types of variation. Is an integral part of any process. Everything you see, there is variation. Right? We did some exercise in the learning session 2 where we looked at our watch, and you can see that the variation in terms of what we think the time is, right? So variation is in everywhere. It is going to be there. I don't think you would get rid of variation. Even if it's slightest, you still have variation. Now, there are two types of variation. We classify the variation into two types. One is the common cause variation, random variation, or we call it unassignable variation. Now, these are the variation which are just there all the time. It's part of process. It's just there. Delays and everything. So it's just there as part of. That's why you see the graph up and down. You never see a graph like straight line. Hardly you see. There's still some ups and downs. So those are the variations in the process which always exist, which we call common cause. Right? Now there's another variation which is called special cause. Now these variation are the result of a specific event which has triggered that. Right? So it's a bit out of norm. Right, like respiratory depression. If you create a graph, if say constipation, the average rate is say 20%, and suddenly 1 week is say 70%. So that's something out of ordinary happened there, right? So it reflects there's something wrong, there's something different is happening in the process. So there are two types of variation we talk about, and we need to get this concept right because throughout the whole measurement journey, we're going to talk about this language, which is it a common cause or a special cause, right? So what is the run chart? Run chart is a graphical display of data plotted in some type of order, right? And we've seen that we need some data points to create a run chart so that we get some good confidence around the median. And it should have a median, and it should tell a story with annotation. And that's an example of it. That's the median. That's your data point. So in this case, we are collecting weekly. So we can say that this is weekly data points, and whatever your matrix is around what you're measuring, so you put that on the y-axis, and usually it's the time on the x-axis, so which we have weeks. So right, now there are certain rules to detect a special cause. Now why are we using this? Because the reason we're using this for the improvement purpose, we are looking for special cause in our data. Right? Special cause, we are trying to track down special cause. We're trying to see, is the process changing? That's what we're trying to find out. And how can we find out in our data? Applying these, how we can identify is that using these 4 rules. Right? Let's go through these rules quickly. So shift, what we call a shift, 6 or more consecutive points, either all above or below the median. Right? What it's telling is there is a shift in the process. Right? There's a shift in the process. That's all it's telling you, right? So that's rule 1, 6 points on either side of the median. And you need to note this point here, which is if a line is on the median, that is not counted towards that 6 points, right? It is just, you don't use that point. It should not be on the line. So be careful about that caveat there. Now, the second rule is trend, what we call trend. This is what in statistical terms we call trend, is 5 or more consecutive points either all going up or going down. Right? So we will be looking back into our data and look for these special causes because this is all reflection of there's something happening in the process. Right? So that's a trend. And then we have number of runs. Which is one of the rules. The easiest way to count a run on your run chart is that how many times this line crossed this median line Just count those numbers and add 1. So that will be number of runs. Once you know how many runs, there is a grid which is on your table as well. You need to see that depends on how many data points you have. So in your case, that's number of weeks. How many runs you should have ideally. So that will also determine is there a special cause or not in your data, right? Rule 3. Rule 4, any astronomical value, which is quite easily detectable, which is completely out of ordinary compared to all the other remaining data points, right? So these are the 4 rules which you can apply to your run charts and see is there a special cause happening, because that's what we are after, to see something happening. So what we can do now, right, so that was run chart. Now there's another chart which we can use to detect variation, and I think this is new to many of you, so that's fine. Just understand the concepts behind it, and we will, if we get opportunity, we'll apply it, right? So Shewhart chart or control chart. Now this is a bit more sophisticated than the run chart. Right? So what are these charts? So it's same as a run chart. It shows the process change over a period of time, right? And it's a statistical tool to distinguish between common cause variation and special cause variation, right? So that's the same purpose with both the graphs. Now, it's invented by Walter Shewhart in 1920s, and since then all the manufacturing and a lot of industries use this to look at the variation and try to see is this variation common cause or special cause, because you take action based on those variations. Right, so this is how a control chart looks like. So let me take you through. So this scale, which is x-axis, is the same time, right, in an order. This is whatever you're trying to measure, this constipation rate or whatever you're trying to measure. This is the average, the mean, the average. In run chart, it was median. Here, it is average, right? You got 2 lines here, which is we call upper control limit and lower control limit, right? And that's based on, that's also called 3 sigma limit. So let's not worry about the technical side of it, but let's understand the concept. So upper control limit and lower control limit. Right? So this is how a control chart looks like, right? Typically. Right, so now control chart also got rules. Now this is much more sophisticated chart to pick up special causes. Anything happening in the process, it can pick up pretty quickly compared to a run chart. So what are the rules? A single point, so outside the control limit, which is these points. We got a run of 8 or more points above or below the center line, which is 8 points. So in run chart, it's 7 points. In control charts, 8 points. So you will get all the rules handouts, and it will be on the shared workspace. And 6 consecutive points increasing or decreasing, that's the trend. And this shift. And then 2 out of 3 consecutive points near the control. So if you got 3 data points and it's on the either extremes, that's also a special cause. Right? And the last one is 15 points within the first sigma limit. So what happens is that this is the upper control limit and the lower control limit. But the whole graph is divided into 3 sections, right? So you have 2 lines in between those 2 as well, which is 1 sigma line, 2 sigma line, and 3 sigma line. Right? Which in some softwares you can easily detect because it draws. So there are 3 lines on either side of that average. And the softwares calculate based on your data, is there a special cause? So the special cause rule is if you've got 15 points within the first sigma level, which is above and below the average, the first phase, that's a special cause. Right? So that's the rule. And some of these charts are not easy to draw because there's a lot of calculations goes behind it. But and usually there are softwares to draw these charts. You put the data and will draw. But some of the simple charts we can create template so that we can create control charts as well. We'll work on it as we go forward. Now, there are different types of charts. Don't worry about the business of the slide. There are different types of control chart which you use based on different scenarios. right? The simplest form is the eye chart, which I shared in the example, simple, and then you use different charts for percentage, right? There are a variety of charts you use based on your metric, your data, and what you're trying to measure. So there's a decision tree around which control chart you use, right? So, and we'll cover that as we go, but let's understand the concepts. So now, when we look at the variation, there are potential two mistakes we can make, which can be quite challenging and disturbing to the whole system. So the first mistake is that thinking that an outcome is due to a special cause when it is really due to a common cause. Right? So considering a common cause, which is the normal common cause, as something special. And the second mistake is thinking an outcome is due to common cause when it was so if there's a common cause and there's a special cause and you treat that special as a common. Right? So for example, if you look at the medication harm or one of those harm data which DSPs produce, for example, respiratory, let's take an example of respiratory. So it's 0, 0, 0, 0, suddenly 1. And that's a special cause, right? What will happen if you take a special cause as a common cause? Right? You're missing an opportunity to find something out, something is happening in your process. You miss that opportunity, right? So it is very important, sorry, I just missed a slide somewhere. It is very important to deal with variation to see what is a special cause and what is a common cause. Because if there is a common cause in the process, you go and tamper with the process, and you make this, there's a likelihood you make the process worse because the process is consistently performing in a certain way. Right? And you think there's something special and you go and tamper with it. So be careful what actions you take based on the variation. Right. So now there's now the Shewhart chart, the control charts are a bit more sophisticated in picking up special calls. Right? And this is one of the little dangers with the run chart is that it's not that sophisticated compared to control chart to pick up special calls. So is there a special cause here? Like the 4 rules, 6 points or 7 points and 1 astronomical. Is there any astronomical point here? Right, we can't really see, right? But if you put the same data on a control chart, yes, there is a special cause. Right? Because run chart is quite visual, and I think it's a really good start for when we collect data to start plotting and see the data and pattern. But as we go forward, if we are looking for special cause, we might need to use much more sophisticated graphs. So, which is, as you can see, the same data, right? Right. So let's talk about baseline for a moment. Now we all have data. Now, I think enough data. Some of the DSPs got less data, but most of them got enough data. Now, for a run chart, we said 10 data points to create a run chart. But control chart, we need more data points. The reason being, this control limit is calculated by the system itself using the data which you input in. Right? It's use the data to calculate that limit. Right? If you have less data points, there's a high likelihood that that limit is skewed. It's not the right reflection. And then you have a wrong special cause, and you start celebrating and all those things. Right? So what we say is that we can start a trial limit when you have at least 12 data points, but the real confidence is around more than 20 points, I would say. Because if we have more than 20 points, we can quite confidently say that limits really reflect our data, right? So, and I think most of the DHP are getting towards 20, and we probably have 20 weeks worth of data. So we will experiment this as we go forward. So what we do with baseline is that we have to agree where our baseline is, how many weeks we are going to consider for a baseline. And what we do in this example, let's say 1, 2, 3, 4, 5, 6, 7, 8, 9 points. Let's say 9 points. We consider this 9 points and extend this median line, right? We freeze this median line. and say, so that's the baseline based on 9 points. We keep it consistent throughout the journey, and we will track the progress against it. So as you can see, this is what we are looking for in our data. Right? This is what we are after in our data, to establish what the baseline is, freeze the limit, median, or if you're using a control chart, and then let's see, are we going to see some changes, right? Now, there's another example of the same thing, but the second thing is annotation. Now, these graphs are supposed to tell stories. If I put just a control chart, I'm sure you won't understand what it is, because many of the people don't understand control chart and what are we looking at here. But what we need to do is help people by putting annotation. So whatever testing or interventions you're doing, annotate on the graph, so that anyone who picks up the graph, they can say, oh, this is where we implemented the documentation. This is where we tested co-prescribing of laxative sticker. So you can associate that journey with a story, what happened behind that, right? So annotation is really important. That tells the story. It's all about storytelling. Right. So what we can do is that you all have your own graphs, and I would say probably control chart is a bit too early. So we'll go back to that run chart rules, and you have the handout on your table. Go back to your graphs, apply those rules, and see what the data is telling you. And also decide what is your baseline, where would you freeze your baseline, and how it look like. So give it a go and see what's the data is telling you. Really some great discussions going on. So why don't we hear some discoveries, what really happened to our data and the graph when we applied these rules. So would you like to volunteer and share your story, the data story? What's your data showing? Anybody who got a special cause in the data? Who got a special cause? So we got Lakes there. Canterbury said they have a special cause with one of the measures. Mid-Central have a special cause. Who else got a special cause in their data? West Coast. Mid-Central, would you like to share your observation in your data story?
We thought that when we had a point hit the mean that we had to start recounting, so we were really pleased to find out we just skipped to the next point, and we've got a couple of positive things with our nursing documentation and our co-prescribing when we look at our data this way. So, thanks.
Yeah, because I think what was happening is when they counted the rule, they didn't think about this little thing. And they were counting and they thought there's no special cause, so it's good. Who else got a special cause? Would like to share? How does that? So is the improvement sustaining? So once it's, if there's a shift, is it still up there or is it back to normal? It's still there. So this is where we want to see that if there is a shift, if there's a trend, it stays there. And that's where we talk about sustainability, and we'll talk about it in a minute. And that's where we want to see with our data. But at the moment, a lot of data is what it's showing is common cause variations, just common cause variation. So we will be keeping an eye on those things. And I've been reminded by Gillian, who's our principal advisor, that the language we use around QSMs and other thing is for control chart is statistical process control charts. Is that right? Great. Thank you. So we will call it statistical process control charts. So moving on, so this is the run chart and control chart, which we'll be using in the near future. But a lot of the talk today is about sustainability, implementation, changes. So how does the measurement look like from that perspective? Right, okay. So how do we measure for sustainability? So the one thing is, first of all, bad news. We need to keep collecting data, right? Because how do we know it's going to sustain? Right. So unfortunately, if we want to know that, we need data, and and this is where we need to think about, and we talk about it later about sustainability. Can we move away from manual to automated system? And this is where right from the beginning I was sharing that there is an opportunity for you to do that for the sustainability if you look at your clinical coding data, right? Because you're improving documentation, which means there is a possibility that you can improve your clinical coding system. Because if it goes into clinical coding, it's an automated report, and then you don't have to worry about manual data collection, right? So think about it. I think some of the DHPs are already testing, and some of the DHPs are already using clinical coding data, so which is really great. So baseline. So what we did so far is that we collected data, and we established a baseline, and we freeze and this is a control chart. So you will do the same with the run charts, but this example is using a control chart. And we extend the average. So this is our baseline, right? This is where we are. Now we start the testing. We work on our different change ideas. We do PDSA testing. And then we see special calls, right? We see things changing. I think it's probably similar to what MidCentral got in one of their graphs. So we started seeing something happening in the process. Now, I think I missed one key thing about control chart. Why do we look at control chart? We look at control chart to detect stability, right? Is your process stable? Is your process under statistical control? That's what the control chart is telling. And if you got a common cause, what it's telling you, the process is stable, right? Now, common cause doesn't mean it's good. What it means is that it's still performing in a very similar way throughout the way, right? That's what it's all telling you. So the process is stable. That's what it's telling you. If you have a special cause, your processes, whichever process you're measuring, it's not stable. Right? And why stability is important? Because if you have a stable process, you can predict the future. Because this variation exists in your data, and you can predict the future because your process is pretty much stable. But if you have a special cause, it's quite hard to predict because it's quite erratic and up and down, so you can't predict what's going to happen next. So that's the main purpose of control chart, is to look at data over time, look at stability, and look at improvement. Right? So going back to this example, so this is the phase where we did a lot of testing, and there's a special cause, and we can see that change happening, right? So for example, say our aim was 90% of documentation or co-prescribing, right? And we're getting there in terms of that documentation or other things. So now this is the improvement period, where we did all the testing. And as you can see, we improved the system, and then this is all the data collection going on. And you can see how the improved system looked like, right? Now, there is a key difference here, this average. We have shifted the whole thing there, right? The reason being, first of all, we need to know the new process is sustaining. So I was talking to Canterbury DHP, and there was a special cause. There was a trend, 6 points, going upward. But it came back, it didn't sustain that level, came back, and it was normal variation, right? So you need to look, when you look for improvement, see that if there's a special cause, and is it sustaining at that level? So at MidCentral, they got around 13 points, 13 weeks probably at that level, so which is really good to see that it's sustaining, right? Once we have a real good confidence that it's sustaining, then only we re-baseline our process. Right? We don't create the new baseline based on 1 or 2 data points. Just if you got one special cause, that might be just a special cause. It might come back. We need to see that whatever the change is has sustained, and your graph will reflect that. Like in this case, you can see that. This is how your graph will look like. Now, you need certain data points before you reshift, you re-establish your baseline. So you can say that my average was, say, 45%, now we are at 95%. To say that, we try to get away from that bar graph before and after, like last year, May it was this, June, this year it was this. Here, we need a good enough data points. So again, we go back to the rule of how many data points we need. So usually we say it's around 20 data points, because we need to be really confident that the new process is sustaining, right? And that's the reason right from the beginning we were kind of pushing hard, let's do it weekly. Because think about if we were collecting monthly, how many years we need to detect a special cause, first of all, right? And to sustain, right? It doesn't make sense. That's why we broke the data down into further subgroup into week, so that we can detect those signals quite early, right? So as we go, we will have enough data points to which will pick up some of those things. I'm not sure how much data points we have, but the idea is to keep collecting, right? So that's how the improved process looks like. Now, we're getting into implementation now, right? And we are really confident the process is working, process has improved. So the question is, which you all are very curious to ask, do we still need to collect data? And I'm sure you know the answer by now. Yes, you do. But there is a help there. Because your process is sustaining at a new level, you can ease down a little bit. And what I mean by that is you're collecting weekly data because you want to detect the signal quite early, right? Which we are doing at the moment. Once you change your process, once you have achieved your new level, you might step back to 15 days and then slowly drop back to 1 month. Because what you don't want to do is just stop, because you don't know what happened after that. So we will transition out slowly, right? If we transition out until there's some automated report. So we go from weekly to fortnightly to monthly, right? So our data sampling will change, but we will make it easy for us. So for example, this. So this was probably, I think, a daily graph. And then once we know, we are highly confident that it's sustained, we moved into weeks. Because there's still data points, we're still plotting on the same graph. And we're still looking for that special cause, and it's sustaining, right? It's giving this indication. And as we are confident, we move into month, right? So we keep a track of that as we go implement and spread, right? But the only challenge with that going to that month is that you can see that you can hardly say is there a special cause, because everything is so close you can't detect. And if you think there's something happening, what you do is you take that data, this much, and make it as a this special cause. You blow it up in a bigger chart, and see what happens, because you can't detect special cause in such a tiny graph. So you take that month of or 20, 30 data points, and then you create another graph. So you can see, hey, we were sustaining at this level, but we have few data points which have gone above that. So there's something definitely good happening there, or it has we have a special cause. What's happening? Is the process going back to the default in some way? So these are the signals which will tell us, hey, it's time to think about it. Not to take an action, but to think about it, because this is all signals telling you, this is the behavior of the process. It's telling you what's happening. It's same like you're one of those health machines, which tells you when to take an action, kind of thing. So we go from weekly to bi-weekly to monthly, right? Right, and so you can see this, we saw this chart yesterday. This is absolutely not a right perfect graph, but I just want to share you this graph, which is the constipation graph, when we put together all the, so this is control chart, right? So I've used a different chart, and you can see we try to establish baseline, freeze the limit, right? And try to see where the data point is going, right? So it's too early and for me to say is there a special cause, because first of all, I'm not confident about baseline because of the challenges we discussed yesterday. I need to figure out the interventions and the testing you all have done and what effect that interventions may have on these changes, right? And so because initially we will only have 2 DHBs who was collecting data. So shall I consider that as a part of baseline? Because that can skew my whole baseline. So there's a lot of questions to be answered when it comes to the data aggregation at the national level. So, and this is where all the discussion is going on, and this is where we need your help with all the list of interventions. When did you test? What happened? So that we can annotate these graphs and see the picture. If this is a reality, what is happening? What interventions happen at different points? Because it will tell a story what exactly is happening. So that's all measurement. So yes, there's a hope at the end of the tunnel that you don't have to continue, but I will highly encourage to look at your clinical coding data, because things like red stamp, because I remember when I was in counties, I was part of delirium project, and I think it was a similar issue. The problem was delirium is not recorded in the clinical notes. and it's not captured by clinical coding, and we can't tell about delirium. So what the team did is probably a similar thing. Okay, I'm over. They did the similar thing. They introduced a stamp. And then they spoke to the clinical coding team that, okay, you have a different definitions around confusion, delirium. So if you see this stamp, this is how the coding is. So what happened over a period of time, I'm sure it's sustained, that we don't have to worry about manual, because the clinical coding start following the new rule, the new change, and then clinical coding get better. So if you look forward, you'll all have an automated report coming, and then you don't have to worry about manual, if it's possible. So I know there are a lot of challenges, but that's just something which you want to explore. So that's about measurement. Any questions on measurement?